Hey everyone, Dr. Bobby Stryker here, rescue.sg. I hope you all had a very nice National Day this year. Unfortunately, I didn't. I was in hospital and I'm here to tell you what happened. So stay tuned. Got something interesting. The doctor becomes the patient. Okay guys, so early hours of National Day, it was about 2 a.m. We'd finished doing most of our house calls. I'd just gotten home and we were just relaxing on the couch and I started to get a bit of a tummy upset. Didn't think too much of it. I thought maybe it's some gastric pain, it's a bit of acid reflux. It'd been a busy day. So, I've got some medicines at home. I took some omeprazole, which is a stomach acid reducing medicine. I drank some liquid antacids, gave it some time. And it was pretty late, coming 1 to 2 a.m. So I decided to go to bed. And I've had gastric symptoms in the past, not common, not regularly, just once in a while. So usually I'll take medicines and it'll go away. This night it didn't. It kept getting worse. And it got worse and worse until I realized it was like 4 or 5 a.m. I was still in pain and the pains were getting pretty excruciating. So about 5, 6 a.m. I couldn't take it. It got really painful. So I thought, okay, it's probably just really bad indigestion. Let's try some more medicines. So I took some Buscopan and some domperidone for wind. At that point, I've taken pretty much all the common gastrointestinal kind of medicines that we often use when we see patients. And it still didn't help. The pain started to get worse. And I just couldn't sleep. I was up pretty much the whole night. Then about 10, 11, I said to Jules, I was like, look, this is getting unbearable. I think something's not right. This isn't normal. And we talked about it and we were like, I think we need to go to hospital. At that point, the phone rang and one of our patients was really in dire straits themselves. They needed some advice, they needed some medicines. So I was in a lot of pain, but we did a video consultation really quickly, managed to help this lady get some medicine sent out. The moment that video consultation was over, I was kind of on the floor in our living room. I was in so much pain, I was in agony. My stomach was really bloated and it literally felt like something was going to burst. And being a doctor, I was pressing around the different quadrants. That's how we ascertain where the problem might be. Is it the gastric side? Is it the gallbladder, liver? Is it down near the appendix, the colon, the intestine? And it still seemed to be in that kind of gastric area where the pancreas also is. So I was a bit worried, could it be the pancreas? And it was a bit there around where the intestines are. But the pain was just unbearable. I was literally on the floor at this point. And we're like, okay, let's get to A&E. So we're based in Woodlands. Some of you probably know our office is in Woodlands. So we got in the car, went down to Yishun Kutepot Hospital, and if you're wondering what happens when you go to A&E right now, this is what happens. You can't go in with anyone. So I had to leave Jules at the door as I walked in towards the triage area where the kind staff, did the basic registrations. They checked my temperature, asked me a few questions, asked me what was wrong, and I was in a lot of pain. I told them, I'm in a lot of pain. I told them I'd taken some medicines, and they were really good. Based on my pain score and what they could see, my vital signs, they brought me straight into the A&E department, and I was seen really quickly. It's no special treatment, guys. They don't know who I am, okay? They assessed me based on my symptoms. I was in a lot of pain, so they came and saw me really quickly. A couple of the A&E doctors came to see me, had a feel of my tummy. They too thought maybe it's just a bit of gastric. They asked me if I'd been drinking. The answer is no. And they sent me for some tests, did blood tests, sent me for an X-ray to see if there's anything visible, dilated bowel loops or air under my diaphragm, which would suggest that something's burst. X-rays came back negative. The blood test also didn't show anything. Now I started to get really, there was a lot of pain. I was getting really uncomfortable. They injected me with tramadol, which is an opiate painkiller, and metoclopramide. And for some reason, metoclopramide, I've had it before, and it makes me really kind of wired. I get really on edge, and being there in A&E on my own with my goggles and my mask on, stuck in a trolley in one corner waiting for an x-ray, and not knowing what was going on, I was getting a bit freaked. It was really stressful. I was really worried what was going to go, and I had to kind of just compose myself. Okay, just like relax, this is the side effect of the medicine, you're in pain, it's going to be okay, I'm in the best place right now. But no one wants to be in hospital. Jules was outside, I really wanted to see her, but I was just there on my own. So got the test done, they didn't show anything. So the doctors were like, hey, seeing as you're in so much pain, let's get a CT scan done. So the CT scan was done, and then finally we got a diagnosis. I developed a condition called small bowel obstruction, intestinal obstruction. It's a potential surgical emergency. What happens is, you've got your mouth, you've got the esophagus, stomach goes down into the intestine connects to the colon, and eventually everything comes out as poop. My intestine had gotten blocked, and it had gotten so blocked, my stomach and the upper part of my intestine had become swollen like a balloon, and it was at bursting point. And after the blockage, everything was normal, but nothing could go down. Nothing could go down. So even me just swallowing my own saliva, I can't drink or anything, is all dangerous, because if anything keeps going down, if it reaches that bursting point, it will literally burst. You'll get something called a perforation, which is a life-threatening emergency. So surgical doctor came down to see me. The first surgeon who saw me is the registrar. If you know the hierarchy in the hospital, at the top you've got the consultant specialist, second in command is the registrar, then you've got the medical officers and the rest of the team down there. So the registrar, surgeon in training, he comes over and he goes, listen, probably need to cut you open tonight. We're going to have to cut you open, take out your entire intestine, lay it out, see where the blockage is, and cut open the blockage, and then it'll be all okay. If things go wrong, you might need to have a bag sticking out, a stoma. And I was like, what is going on here? They said, okay, well, let's give you some painkillers. We'll get the consultant here. He'll be here in a couple of hours to see you, and then we'll see whether we need to operate on you tonight. It was as scary as you can imagine. I was talking to Jules, and the two of us, we were like at breaking point. I called my parents, called my brother, called my family in the UK. My mum was like super distressed. It was, I could hear her bawling in the background. And so what do we do here? So they decided that they need to suck out the contents of my stomach. So to do that, need to put in an NG tube, nasogastric tube, a tube through my nose into my stomach. Commonly, these are used for feeding for patients who are elderly, who have difficulty swallowing, maybe sometimes after a stroke. The purpose of my NG tube was to suck stuff out. So they can't go with a normal NG tube. They had to find the biggest NG tube, like a hose pipe, and shove it in. And it was very, very uncomfortable. Now I can't eat or drink anything too, because if I put stuff into my stomach, there's the risk of bursting my stomach and intestine. So they put this giant NG tube in, and that in itself was terrible. And every time I spoke or I even breathed, I was just doing any kind of movement, it was so painful. And they were sucking out the stomach contents while giving me an IV drip, because I still need to make sure I'm well hydrated, especially because I'm nil by mouth. They keep you nil by mouth in case they have to rush you into the surgical theatre to do an emergency surgery. I was in so much pain. The tramadol that they'd injected wasn't working. The doctor came over and said, look, we're going to inject you with morphine. I've never had morphine before. I don't condone the use of opiates and drugs, but I tell you, it really worked. The moment that was injected, I was like really high. There's no other word to describe it. I was literally high. The pain just disappeared. And I was like, okay, I might, I was getting really lightheaded, and the doctor said, okay, let's lie you down. But the pain instantly disappeared, and it was like, wow, this is amazing. And then the consultant came along, examined me. He moved around the tube, tried to suck out everything. Something came out. I'll get back to that. And then discussed, why is this happening? Because normally this only happens to people who've had surgery before, and I've never had any surgery in my abdomen. They said if you've had surgery before, when it heals, you can get connective tissue, get stuck together, it can trap the intestine, and then it leads to intestinal obstruction. I've never had surgery, so it was really bizarre. So they suspected that maybe part of my intestine was always a little bit narrowed, and something kind of tipped things over the balance, and it was too much for my intestinal system to handle, and it got stuck and it got blocked or twisted or whatever. So the plan was possibly to operate. But once the surgeon had a feel of my tummy and said, look, son, you're a young guy, it's your first time, let's see what we can do. And they did some tests which showed that I wasn't at a critical stage. My blood wasn't getting acidic or anything like that. My lactate, which is something they test on a blood gas, was normal. So they got time, time to monitor. So they kept the NG tube in, continued the fluids, pain relief, nil by mouth, nothing to eat and drink in case they have to operate. Now came the dilemma of beds. There was no beds in the hospital. So I was stuck in A&E for 24 hours like this. My phone was dying. I was trying to keep contact to a minimum, but still, I was there on my own. I was really scared. And I was trying to message Jules and my family, and they were great. And people started messaging. The messages started flooding in to our social media for rescue. People had now caught wind that something wasn't right, and I'm so grateful. All this moral support that I received really got me through. And I said that Kutip Pot doctors don't know me. Well, one or two, turns out that they did. A couple of the A&E doctors came over to wish me well. They said that they'd seen my referrals sending patients there, and it's the first time meeting me. And they came over to wish me well and hope that I make a good recovery. So that was nice. After a full kind of 24 hours or more, I finally was transferred up to a ward. Current situation is you can't get to choose what kind of ward you go to. It's all C class. The rest of the wards, I think, in relation to COVID and stuff, they're segregated. So it's a C class ward, and it's almost like the ward is outside. They're all open walls, and there's like plants and vegetation and everything. Shared ward, and I was like the youngest guy in the ward, and it was just a little bit bizarre. Everyone looked healthier than I did. All these old guys, they were walking around. I was stuck there, can't move, with a tube in my nose and the drips going on and all this. And the idea is, if they suck everything out of my stomach, if it starts to kind of move again, things start to flow through, I might be able to avoid surgery. So how do I tell if things are flowing through? The pain will start to go away. My stomach won't feel bloated. And I'll start passing poop. Yeah, I'll poop and I'll pass wind, okay? I've never seen anyone so excited to ask me about whether I'm pooping or not. So every few hours, the nurses and doctors will be like, hey, doc, are you pooping? Are you farting? And I'll be like, yeah, I'm farting. Excellent, excellent. They were so excited about it. So, not out of the woods yet though. It was still a waiting game. You got to take it really cautiously. They wanted to see if the blockage was still there. So they sent me for a barium swallow. Actually, kind of swallow chemicals, and then they can use a special X-ray to visualize it going through my digestive system and see if it comes out. And it did. It went through. And on this scan, the barium swallow, they couldn't see a blockage. But they said, we still got to pay it easy. Continue the fluids. You can start to take sips of water now. That's what they told me. So I started taking sips of water. Still nothing to eat or drink. It's been 3 days without any food. I was starving. And the doctor came to see me again. The surgeon was like, listen, I think things are going well. Tomorrow we're going to let you have some diet. And if you can tolerate the diet, then, and if you continue to pass wind and poop, which means that everything is flowing through your digestive system, we might be able to let you go home. So that's what they did. They slowly kind of built me up onto the foods. It wasn't very nice. It was like porridgey things, which is fine, but they make it extra bland in the hospital, because it has to be super healthy. And gave me some soups and fluids and things like that. After 3 days, then they were finally comfortable. Okay, we could try. What was that, third or fourth day? Either way, they finally said, okay, let's remove the NG tube, which was like the best thing. It was literally like agony having that in there. I couldn't breathe and couldn't swallow, couldn't speak. Yeah, and any movements would just hurt so much. So finally they got the NG tube out, and I started to feel a little bit like a normal person again. And just being in hospital was exhausting, like not eating anything or drinking anything for 3 days. I'd lost almost a kg of weight, which was like not a healthy kind of weight loss. And you can't sleep because there's always activity on the wards. Every 2-3 hours, the nursing teams, they'd come and check my blood pressure, check my vital signs, make sure things are stable, check my sugar. They would check the NG tube, they would aspirate every 2 hours to see what they can suck out of there. And then came to the discussion. Discussion is, what caused this? We suspect there might have been a narrowing in your intestine, which may still be there. But something tipped the balance. What was it? What have you been eating? Okay? What do you think it is, guys? Because we've narrowed it down to a possibility. And this food I now have to avoid. What do you think? Was it pizza? I love pizza. Was it burgers? I love burgers. Double Whopper. Was it spicy food? Was it a curry? What do you think, guys? It was broccoli. That's what it was, broccoli. Yeah, vegetables. Low carb vegetable, popular in all the health world. Broccoli. For the last 2 weeks, I've been eating tons of broccoli. I'd get a whole floret of broccoli and I'd eat the whole thing. And immediately I would feel really bloated. I just thought I was just getting used to the digestion of it. You know, I Googled it and it's quite common. People get wind when eating broccoli. And it challenges the digestive system, which is why people say it's good for you, because it kind of gets your digestive strength and increases that. But I guess for me that wasn't the case. Broccoli is the culprit, and they suspect it was too much for my digestive system and it got stuck. So on that first day in A&E, when they were suctioning stuff out of my stomach, even though it had been like a whole day since I'd had a meal, there was undigested green broccoli pieces coming out. So they were like, okay, you have to follow a low fiber diet now. Doctors always tell you to eat more fiber, right? Because it helps you to poop. It just goes to show you, it's never a one kind of solution fits all scenario, even for me. So now I'm on a low fiber diet, which means that pizza and stuff is probably actually better for me, surprisingly. I've got to be careful with certain vegetables. So broccoli is a suspected culprit. It had been causing me a lot of wind and bloating for the whole week, and I guess it kind of reached a boiling point and it really kind of bunged up my intestine to the point where either it twisted or it completely occluded and blocked up, and it could have burst. But I was lucky, I managed to avoid that. I managed to avoid the knife. And I was able to tolerate and eat hospital foods and drink fluids, and my digestive system was working, and I was finally pain-free. And the doctor said, okay, go home, take it easy, rest. We're going to give you an 18-day MC. I was like, doc, I don't need it. I run my own thing, I run my own show. And they're like, no, take it, you need the rest. Finally, Jules and the family are there, pick me up from the hospital, time to go home. And our patients call. And our patients don't really have much choice. A lot of my patients are bedbound and they have certain needs and difficult situations. So pretty much within hours of leaving hospital, I was back in action on the road and doing my best to help people. And that's how it is. So after 4 days of being in Kutipot Hospital, I was out. And now I feel pretty okay. It's been over a week. I feel pretty normal. I'm still a little bit paranoid about eating certain things. I ate some bok choy yesterday and I was worried, is that gonna happen again? I'm a little bit worried about it, but I feel good. I've worked out and I'm just trying to get back into things. I'm super grateful to everyone at Kutipot. They did a fantastic job. All the nurses, the doctors, and everyone there. Thank you all so much for taking care of me. I really appreciate it. Thank you from the bottom of my heart. Thank you for not cutting me open. And thank you to all our fans and friends on social media. The messages have been pouring in left, right, and center. I am so grateful to all of you. It really gave me the mental strength to get through this. It was really scary. Yeah, like I said, I was really scared. I didn't want to go under the knife, and it would have been a major surgery. I would have been scarred up, and who knows what complications might have come out of it. And yeah, so that's pretty much it. It's a national day to be remembered, that's for sure. Not really for the best reasons, but I feel good. And that's about it. So I hope that gives you some insight into this fairly uncommon condition, small bowel obstruction, intestinal obstruction. And if you have any questions or messages, feel free to drop us a message or an email, or contact us through social media. And thanks again, really appreciate it. So I hope you've enjoyed that. I'm not telling you to avoid broccoli, that's just unique for me. But yeah, take care of yourselves and your loved ones, stay safe, and we'll catch you guys in the next video. All right guys, there you go. See ya, bye.
Dream that no one could save you. A shelter, a whole lot, the light that die with the
So I was woken up at 6:30 for a nice blood test. But yeah, hopefully this is gonna be discharge day, so let's see what happens. So some good news, the doctors came around, said if I can eat and drink and don't feel anything, I can go home. Yay! Got some solid food. Yay! Some sandwiches and what's that? Some soup, is it? Oh, it's a drink. Probably Milo. Yay! On the road to recovery. So if I eat stuff and I don't feel any pain, that means the blockage is gone. Fingers crossed. This is it, it's here, the final pre-discharge meal. Let's see what we got. It should be porridge, I think. There you go. Some kind of porridge, juice, and whatever that is. So yeah, here we go. Let's tuck in. Here we go. Doesn't smell good at all. My pot. It's very soft. It's edible. It's not bad. Gonna do it. It's like a flavorless dal, chicken and rice. Maybe this is why I always prefer dal with rice and chicken curry instead of just dry. Maybe I've always had an inclination for it to be a bit more soupy. Thank you, Amma. Yay. Thank you.